Good afternoon and welcome to the City and County of San Francisco's COVID-19 update. For Q&A, please state your name, outlet, and up to 2 clearly stated questions in WebEx chat. And now we welcome Mayor London Breed.
Good afternoon, and thank you all for joining us here today. After almost a year of this pandemic, we can finally see a light at the end of the tunnel. We're not there yet, but that day is coming, and it is coming soon. We've been preparing for this moment. We're eager to get there, and we're gonna be ready. No one wants to open the city more than I do. And today, I'm proud to announce that we have a plan to work with our private healthcare providers to create a network of vaccination sites in San Francisco, including 3 large sites that will allow us to quickly vaccinate people once we have the supply to do so. This has taken a lot of work, and I really want to recognize how this is an example of public and private sectors coming together to deliver for the common good. I know there have been a lot of questions about the vaccines. I know that there's been a lot of misinformation that has been out there in the public. I have a lot of the same questions, including how we get more vaccines. My focus has been on setting up the city to be ready when we do get vaccines and making sure people know where to go when it's their turn. Look, this pandemic, it's not easy. But I want to be clear with the people of San Francisco. We have a plan. We are moving these vaccines forward. We can do this together. Testing was hard at the beginning too. I remember several months ago when Dr. Colfax was talking about how we didn't have enough cotton swabs to collect samples. But we worked through that. And we set up a system to make sure that thousands of people could get tested every day. And while we don't have direct control over how vaccines are allocated to our city, we can do everything we can to make sure it is as easy as possible for people trying to get them. Today, I want to walk you through where we are with vaccine distribution, our next steps, and what you can expect once we are actually receiving enough doses locally to get where we need to be. Let's start with where we are now and how the city is managing that process. The federal government and the state are distributing the vaccines. In California, the state is giving vaccines directly to healthcare providers, which includes providers like Kaiser Permanente, Dignity, UCSF, and Sutter CPMC, as well as our own Department of Public Health. As a healthcare provider, the Department of Public Health is in charge of giving doses to workers in our city-run hospitals, like San Francisco General and Laguna Honda Hospital, the largest skilled nursing facility in this country, as well as their patients in the San Francisco Health Network. So we have vaccines being distributed in San Francisco from a number of different sources, which I know can be quite confusing. And we know in a pandemic, confusion is a huge problem and clarity is essential. People are tired, they are scared, and they just want to know what they can do to get the vaccine. That's why we are working with our private partners to create a network of sites to bring all of these different groups and efforts together. To start from the beginning, the state has set the guidelines for prioritizing which populations are to receive the vaccines first, which means we must follow those guidelines. The city is currently in phase 1A, which initially included frontline healthcare workers and people in skilled nursing facilities. To give you a sense of how this phase compares in San Francisco to a lot of other counties, it's important to remember that we have a massive world-class hospital system that anchors the entire region. That's San Francisco General, UCSF's hospital at Mission Bay, Parnassus, and Mount Zion, CPMC's brand new campus on Van Ness, St. Luke's in the Mission, St. Francis and St. Mary's, Kaiser on Gary Boulevard. Those are just the hospitals. We are so lucky to have this incredible healthcare system. But it also means we have between 80 to 90,000 frontline healthcare workers in the city. So that tier is bigger for us than it is for other counties in this state. This is important because while people 65 and older represent just 15% of the total infections, they are 85% of the total deaths. So DPH is now serving people in the San Francisco Health Network who are 65 and older. I know our private providers are starting to do the same. Of the vaccine doses that we have received directly to the city through the Department of Public Health, all of them have either been administered or assigned. We are not sitting on any vaccines. They are all moving out the door. Since the state is giving vaccines directly to a number of different healthcare entities, in addition to the Department of Public Health, the majority of doses aren't controlled by the city and county of San Francisco. But what we've been working on what we've been working to do is to bring all of these healthcare providers together with the city to mobilize all of our efforts together. And here's what that looks like. First, every resident in San Francisco, every resident can go to sf.gov/vaccine notify, VACCINE sf.gov/vaccine notify, starting on Tuesday. Enter your information, and when it is your turn to be vaccinated, you will be contacted with what you should do to make that happen. Again, that's sf.gov/vaccine notify, starting on Tuesday. As a reminder, the vaccine is limited, and we are still in phase 1A, so you may not be contacted for a little while. In terms of distribution, we are ready to ramp up to distribute 10,000 doses per day in the city, as long as we receive the supply to do so. Locations are easy to get access to all over San Francisco. We have many city facilities. We have many empty parking lots. We have people reaching out to us, offering their locations for vaccine distributions. The locations are not the problem. It's the supply. And if that supply significantly increases, our facilities will be ready to exceed this goal and handle as much vaccine as we receive from the state and federal government. To do that, we're moving forward with a plan to create a network of vaccination sites. Some will be large sites, others will be smaller community-based sites. The key to this network is that we will work with our private providers to provide easy access and meet people where they are. These larger sites include ones we are setting up at City College, one in the Bayview at the SF Market, and one at Moscone Center. Each of these large sites will have spaces for all of the city's healthcare providers to set up and vaccinate their members, creating coordinated, centralized vaccine locations that people can go to regardless of their provider. The first of these sites will be ready to go next week, as long as we receive a sufficient supply of vaccines from the state. And we're ready to ramp up even more as soon as we have the vaccines. To increase availability to those people living in high impacted communities, we will bring pop-up vaccination sites and mobile vaccine teams. These neighborhoods will also be served by the Department of Public Health community clinics, as well as other safety net clinics for uninsured or underinsured. We're also working with One Medical, Safeway, and Walgreens to deliver vaccines as doses become available. For example, Walgreens was instrumental in helping us to not only vaccinate the staff at Laguna Honda Hospital, but to vaccinate all the patients at Laguna Honda Hospital who agreed to the vaccination. But I want to be clear, the vaccine doses we have received remain limited. We're ready for more doses. We need more doses. We're asking for more doses. We can ramp up and open these sites the minute we have the vaccines. We're mobilizing the entire city. That means the city government, and it means our healthcare partners. We're all on the same team here. San Francisco has led from the very beginning It's why we have one of the highest rates of testing per capita and one of the lowest death rates in the entire country. Since the beginning of this pandemic, we have seen less deaths in San Francisco over the entire time. And Los Angeles County, for example, their death rate in one day alone yesterday matched our death rate over this entire pandemic. We know that it's been hard. We know that we want to get our economy going. But I want to be clear, we are ready to do what is necessary to make sure that we get these vaccines to people as quickly as we have them. I want to really recognize all the city staff who have been working tirelessly to put this effort together. It's not easy. It's one thing to say we need to do something. It's another thing to actually put it all together. And the folks who have been working on the front lines, the people in the Department of Public Health, city staff and agencies, they have been working closely together to make sure that when this is executed, it goes off without a hitch. To the residents of San Francisco, we are doing our best to support you and to provide clarity. And I know it's not easy, but we are here to do everything we can. And we are. I also want to thank all the providers who are working with us, Kaiser Permanente, Dignity Health, CPMC, Sutter, and UCSF Health. This is a huge effort, and we appreciate their cooperation because we cannot do this alone. It takes all of us coming together to move this forward. Today, we have Carrie, Owen, Pleats, who is the president of Kaiser Permanente Northern California, to talk about the work Kaiser is doing, both working with us and to help get people vaccinated quickly. But first, I want to take this opportunity to introduce the Department of Public Health Director, Dr. Grant Colfax, to say a few words.
Well, good afternoon, everybody, and thank you, Mayor Breed, and welcome, Carrie, Owen, Pleats. Mayor, your leadership and unwavering commitment have brought us to this moment. And you know, so much of what I've shared with all of you this year has been hard news to hear about how things are bad and how they may get worse. Well, I am delighted that today is a day of good news, at least mostly good news, and I am so thankful for that. Now is a time that seemed unimaginable to me and so many of us just 6 or 8 months ago. Now is a time when we are rolling out COVID vaccine and getting shots into arms. I want to thank our healthcare providers, including Kaiser, Dignity, CPMC Sutter, Chinese Hospital, and UCSF, who have literally stood shoulder to shoulder with us as we care for those in our hospitals suffering the most from this virus. And now, as we move forward together, we do stand shoulder to shoulder as we vaccinate people and eradicate this terrible virus from our city. Look, we have been on defense. Now we go on offense. You know, during this pandemic, I've often referenced how this city came together during the worst days of the AIDS pandemic and our amazing response. We did that together, and we did that even without a vaccine. We have vaccine for COVID. They are good. They are safe vaccines. They are our ticket out, and we will get it done. That's what we do in San Francisco. Indeed, our creation of a network of vaccine sites would not be possible without our city workers, our community and business partners, and all San Franciscans. There have been no easy decisions nor easy answers during this time. But as a city, we have come together. We have made sacrifices. We have been resilient and overcome so many challenges these past few months. Our collective actions have saved lives and protected our capacity of our healthcare system. As we roll out this unprecedented vaccine, Let's recognize the thousands of city workers that have tirelessly worked throughout this pandemic. This includes our healthcare workers who have worked with tremendous devotion, but also the hundreds of city employees that we have deployed in our COVID-19 response. From the project manager now overseeing a testing site, to the librarian working on our contact tracing team, our city workers have dedicated themselves to the care and healing of the people of this city. And let me tell you, we have an incredibly impressive team. We have engineers and environmental specialists making sure our schools are safe for in-person learning, and transit operators greeting and guiding people through testing sites. We have city employees who volunteered to be deployed to our isolation and quarantine hotels to support people in their time of need, as well as deployed to our safe sleeping sites. Our team includes city employees who are working with community leaders and business groups to ensure that we are keeping communities informed on the ever-evolving pandemic, as well as those employees who crunch data that help guide our decisions, and still others that analyze the policies and best practices to keep us safe. We have people across the city running testing programs, food programs, and financial relief programs. They raise and solve issues relating to equity, accessibility, and efficiency. They are transit operators, homeless outreach workers, EMTs, paramedics, public safety personnel, environmental service and public work employees that show up each day to work on the front lines to keep our city functioning. And for that, I am grateful. Our team embodies the very best of who we are as a city, and we will emerge from this pandemic as a strong city because of them. We are stronger together, from our city workers to our nonprofit partners, to our community partners and business partners, and of course, our healthcare provider partners. Our successful rollout of vaccinations will require that we work together and continue to remain vigilant. Because even with the arrival of vaccines, we must still take precautionary measures. We are still seeing an increase in cases and hospitalizations. Unfortunately, our case rate is higher than it has ever been. But vaccines are our way out, and we need more as soon as possible. I want to make that clear. And even with increased supply, the estimates are that most of the general public will not receive vaccine until later in the year. Until then, and even if you are vaccinated, we must all continue to take the precautions we know so well. We will emerge from this pandemic a changed city, but I truly believe a better city, because we have experienced what we can do when we work together, when we consider our individual actions and the impact they have on the collective whole, when we work together to care and heal for ourselves, for each other, and for our city. Now, I want to introduce Carrie Owen Pleats from Kaiser Permanente, who has partnered with us throughout this pandemic and who is committed to our goal of vaccinating more than 10,000 people a day when the vaccine is readily available. Thank you.
Great, thank you so much, Dr. Colfax, and thank you also to Mayor Breed. Apologize for the video, how it looks. I'm actually at one of our hospitals today, who is seeing one of the surges down in Santa Clara and supporting the team on the ground. It's great to be here today, and we have been dealing with this devastating effects of COVID-19 pandemic has brought to our families and our friends. We've all been negatively impacted in some way, and we've lost loved ones and we've suffered ourselves. We've also seen the rise of the human spirit through heroic efforts across our communities, from healthcare workers on the front lines, to the teachers who are helping our kids at home, to grocery store clerks, and just neighbors who are reaching out to care for each other. It underscores for me that there is so much hope and so much optimism in this discussion, especially this announcement today. The COVID-19 vaccine represents a return to normalcy, a return to our communities, our businesses, and an opportunity and obligation to care for our most vulnerable friends, family, and neighbors. We, along with Mayor Breed, Dr. Colfax, and our many public and private sector colleagues, are committed to getting COVID-19 vaccines to our communities as soon as possible, based on the vaccine allocations we receive. We are really pleased at the level of interest in our communities for vaccination. We have said in anticipation of a vaccination that if we can get people lined up to get the vaccine, that would be a great problem to have. Maybe not a long line, but in a line, because we want everybody to get vaccinated. It is a safe and effective vaccine, and we want to make sure that it eventually ends this pandemic, as Dr. Colfax outlined. At the same time, this is an evolving situation. Combined with current limited vaccine supplies, presents, like everything else in this pandemic, an unprecedented challenge. A vaccination effort of this size is new for all of us. And we want to acknowledge also the frustration that so many of you are feeling as you try to get vaccinated or understand when you can and when you should get vaccinated. New information is emerging often within a few hours, days, and we are pivoting quickly to get vaccinations to everyone in this extraordinary and confusing time. Just yesterday, we received 4 times the normal call volume into just one of our call centers. We appreciate your patience. I'm trying to get some of my own and are working to get you vaccinated as quickly as possible as the vaccine supply allows. Like other healthcare providers, Kaiser Permanente is an approved vaccine provider in every market that we operate. As an approved provider, we have received a limited supply of vaccines that we are administering. Consistent with the guidelines, we have prioritized individuals in phase 1A, and those are healthcare workers in clinical and non-clinical roles who work in hospitals and urgent care settings, who provide COVID-19 patient care and come into contact with COVID-19 patients. For this focus on phase 1A personnel, our most at-risk healthcare personnel, both inside Kaiser Permanente and in our communities, continue to receive the vaccine based off of the CDC's priority phases and the state of California guidance to date. We proudly applauded our physicians, nurses, and patient-facing staff who received the first vaccines, and now a majority of them in phase 1 have taken not just their first dose, but many have received their second dose. We are also vaccinating external healthcare personnel in phase 1A who are Kaiser Permanente members or members within the community, regardless of their health plan membership. To date, Kaiser Permanente has given first dose vaccines to over 90,000 healthcare workers. With second doses, if you include the second doses, over 120,000 doses of the vaccine so far, and that is increasing every day and every hour. We vaccinated more than 9,000 healthcare workers who are not Kaiser Permanente staff, and more than 1,600 individuals who are also not Kaiser Permanente members, because our role is to work as part of the community to ensure that everyone gets vaccinated. With the expansion of the vaccine eligibility to those over the age of 65, it's time for hundreds of thousands more of our neighbors eligible to receive the vaccine, and that will be expanding rapidly. We have been preparing for this expansion of eligibility of priority groups defined within the state. The successful delivery of the vaccine to people over the age of 65, even as we continue to vaccinate those within the original priority groups, again, depending on the access to adequate supplies of the vaccine and appropriate sites for mass vaccination. But we are committed to ensure that we act as quickly as possible to provide the vaccine to those who are eligible and soon to everyone who wishes to receive it. We've been partnering with counties to vaccinate phase 1 populations. We're broadly working to expand vaccination locations in all of our markets. And here in San Francisco, we're pleased to be working with Mayor Breed and together with other healthcare organizations that were outlined earlier to create mass vaccination sites as quickly as possible. And again, as vaccine supplies are available. I would be remiss in this moment if I did not remind everyone that even after you get the vaccine, it might be a few weeks before you have full immunity. I also want to remind everyone that even with the vaccine, we must continue to protect our patients and our families and ourselves. We are hopeful that vaccine supplies will increase and allow us to more quickly vaccinate more people. Meanwhile, COVID-19 remains in our communities, and it is essential that everyone continue to protect themselves and others by using masks, washing hands regularly, avoiding gatherings, and maintaining physical distancing. We can do this. We can do this together. I want to thank Mayor Breed, Dr. Colfax, and all of our colleagues in healthcare for working through such a challenging effort, wrestling with many complex components of such a program, and committing to rising to the occasion. We are privileged to step up in this challenge and serve our communities in this very, very important way. Thank you so much.
Thank you, Carrie. And look, I know this has been hard for everyone. We've come too far to start falling apart now. We've come too far to start to see things explode and chaos created. There's so much misinformation out there. There's so much confusion about the vaccines, and we are here to set the record straight. I know people are asking us to put up all these sites everywhere. Well, we're putting up sites. We just don't have complete control of the vaccine. But we are going to fight every single day to get as much as we can because I want to get our city open. It was so hard to make a decision last year to close the entire city and county of San Francisco. That has never happened in any of our lifetimes. So just imagine the fact that we are almost a year into this and we are still closed and we are seeing the numbers increase and people are frustrated. Not just are we trying to protect people's physical health and make sure that we don't continue to lose lives to this virus, the challenges around mental health, our kids who aren't in school, our businesses that will never come back because of this pandemic. I know more than anyone, with everybody's life riding on my shoulders, the importance of getting this city open as quickly as possible, which is why this plan to move our city important is so critical. But what we don't need, especially from other public and elected officials, is misinformation about what is actually happening in San Francisco. So we're asking you all to be careful about what you say, especially because when you talk about something that is not true, it puts fear into the hearts and minds of the public. Our goal is to instill hope. We want you to know that we have a plan, that we stand ready and prepared to serve the public in a way that gets this vaccine to people as quickly as we possibly can. We are doing everything to get our city open again so that we can begin to come together again. This is more important than ever. So again, San Franciscans, I need your understanding and I need your patience because we are going to get through this. We've come too far to go backwards. So let's think about that time when we're going to be able to come together to celebrate our child's second birthday party, or visit our grandmother or grandfather in Laguna Honda, or have a family gathering where we won't wear a mask. Those days are coming. Those days are coming, and for now, we need your patience and understanding as we go through this next phase of vaccinations for the people of this city. That's how we're going to get through this. So thank you all so much for joining us today. I hope today's press conference provided you with a lot more clarity than what you've had in the past. And with that, we'll open it up to some questions.
Thank you, Mayor Breed, Dr. Colfax, and Carrie Owen Pleats for your remarks. Just before we begin, we're going to take a quick pause and let our reporters submit questions via WebEx. We'll be right back. Thank you for your patience, Mayor Breed. The first question is for you, Mayor, and comes from Kevin Stark of KQED. The Washington Post is reporting that the Federal Reserve of vaccines is used up. State health officials across the US had anticipated vaccine delivery next week, and that might not be arriving. Can you speak to how this will impact the vaccine rollout in the Bay Area?
Well, the fact is, as you know, we're not making the vaccines ourselves. We have no control of what we get and when we get it, but we do have control over if we're ready to distribute it, and we are ready. We're not sure what's going to happen. We're not sure on every single day what we may or may not get. So the fact is, I'm not sure. We don't know if that's entirely accurate, but my hope is that those vaccines are getting made, that they're getting delivered, and we're able to administer them to people. So definitely, if that doesn't happen, it will have an effect on the vaccine distribution, but our hope is that it doesn't.
Thank you, Mayor Breed. The next question comes from Ron Lynn of the Los Angeles Times. Mayor Breed, as an elected official, you often hear a lot from your constituents, and Dr. Colfax has credited people staying at home in San Francisco for blunting the impact of the surge. Was there a moment in the last few months you can recall where you felt people suddenly changed their behavior to stay at home more? When was it, and why do you think it was successful?
I think it's hard to say. I do spend a lot of time walking around the city. I do see people doing everything they can to wear their masks, to keep their distance, and interact with people outside as safely as they possibly can. I think for the most part, people have been just trying to do their very best. And are they messing up every now and then? Yes. Do we have 100% compliance? No. But for the most part, you see people walking. When I'm walking down the street and a runner is coming towards me, most of them, not all of them, but most of them will put on their mask as they walk past me. And they should do that every time they walk past anyone. So I just think it's really tough to say, but the more that we do, the better off we'll be. And we still have some challenges with that, but this vaccine brings us hope, and hopefully we'll get to a place where things won't be as problematic.
Thank you, Mayor Breed. The next set of questions are for Dr. Colfax.
Hello.
Excellent. Dr. Colfax, your first question comes from Ron Lynn, also of the Los Angeles Times. Dr. Colfax, while other areas of California have had heated public debates among elected officials over stay-at-home orders, San Francisco's elected officials have largely been in agreement. Has that made it easier to sell stay-at-home policies to San Francisco residents? And do San Francisco's ICUs still have decent available capacity?
So thank you. I think it's really important that we celebrate and recognize that San Franciscans have responded to the science, data, and facts in terms of the prevention methods, adopting the prevention activities, behaviors that we know prevent the spread of this virus. It's not a matter of, with regard to the question, it's not a matter of selling to the community. It's around the community being with us, being empowered, being supported to protect ourselves and one another from the COVID-19 spread. So I think it's really incumbent that we understand and recognize that it's the people in San Francisco who are making this happen. They are slowing the spread of the virus. And the leadership, the policymakers, the leadership of Mayor Breed is delivering the message, and people are responding because they know that we need to protect everyone in the city. With regard to the ICU capacity, we still have good capacity in San Francisco. We are at 26% of our ICU beds are available. But once again, we follow that very closely. We have more beds than most of the other regional counties, and certainly more than many other regions of the state. So we're continuing to watch that very carefully. Our cases, again, are higher than they've ever been before. So that capacity could well go down in the next couple of weeks.
Thank you. The next question comes from Trisha Dadani of the San Francisco Chronicle. When will the sites open and which ones will open first? And how many doses has SF received so far and how many has it administered?
So at this time, we expect these sites, which will be able to deliver 10,000. We're aiming for 10,000 vaccines a day when vaccine becomes available. We are working to open all 3 of these sites as quickly as possible and as needed according to vaccine supply. And with regard to the first site that opens, we expect that the City College OMI site would be ready to open as quickly as the end of next week, depending again on vaccine supply. So again, you just saw today the federal government made what I found a very confusing announcement about vaccine supply, what was held back and what wasn't held back. I can tell you that our vaccine supply, what we're allocated to from the state, which again, we have no control over, jumps up and down. So what we receive fluctuates week by week. And sometimes day by day. And as an example, we were recently told by the state that next week we would get 1,700 vaccines, whereas a couple of weeks ago we got 11,000 vaccines. So it's very hard to plan for this, but our commitment is to getting vaccine into arms as quickly as possible. All vaccine that we have received has been allocated and dedicated to people. So we are not sitting on vaccine, we are getting it out the door as quickly as possible. We will be ready for as many vaccines as we can get. 10,000 vaccines a day is our goal with these mass vaccine sites and this vaccine ecosystem that we're setting up. We need the vaccine, we need it now.
Thank you, Dr. Colfax. The next question comes from Dan Kerman, Cron 4. Dr. Colfax, what is your advice to people who want to get a vaccine? Do they contact the county? Do they contact their provider? Do they wait for their provider to contact them? Is there a sign-up list?
So most people will get the vaccine from their provider. The city has a notification site that they can sign up on to tell them when they are eligible for the vaccine. And then we will encourage people to also contact their provider. And for the most part, the providers that we have partnered with are keeping their patients and patients up to date on availability of vaccine. But I think the other key point with this scale up of these mass vaccine sites, when we have vaccine available, our vision is that people can get the vaccine as long as they're eligible as quickly as possible, and people can go to those sites. The issue right now is we simply don't have enough vaccine.
Thank you, Dr. Colfax. The next series of questions will be for Carrie, Owens, Pleats. Ms. Pleats, your first question is from Lily Tan, NBC Bay Area. How does the news of no increased shipments of vaccines impact Kaiser's rollout plan?
Well, I think as Mayor Breed responded to that, it's been a communication opportunity. So I'm hoping that information is inaccurate. And hopefully, even if it is accurate, that we can work together as a country to change that answer. As you can imagine, as what Dr. Colfax highlighted, if we do not get vaccines, because we are not sitting on vaccines either, as soon as we receive a vaccine, we are actively working to get them into arms of the individuals who are in the high-risk categories of phase 1A, and now that we've expanded to the greater than 65. So if we don't have vaccines to give, we don't have vaccines to give, and it will impact us. And I want to highlight again, I hope that's inaccurate information, and hopefully we can work together as a country and get those vaccines out to, and a steady supply of vaccines, as Dr. Colfax was mentioning, switching from 11,000, as he was saying, to 1,700 is also what the providers within the community are also experiencing. When we can get to a steady, reliable state of vaccines coming in, we will have a much more sophisticated and reliable delivery system to get out to our members and vaccines to the community.
Thank you, Carrie, Ms. Pleats, for your time today. And this concludes today's press conference. We want to thank Mayor Breed, Dr. Colfax, and yourself, Ms. Pleats, for your time. For future questions, please email dempress@sfgov.org. Thank you and have a nice day.